Do you frequently deal with bloating, abdominal pain, diarrhea, or constipation, but all your testing comes back normal? This could be a functional GI disorder called irritable bowel syndrome, also known as IBS. In this video, I will go over 5 signs that could be associated with irritable bowel syndrome and when it's important for you to see a doctor. Hi, I'm Dr. Andy Thanjan, a gastroenterologist, and I go over digestive symptoms and conditions such as IBS. IBS is when the intestine looks normal, but it does not function normally. And this is due to something called the brain-gut axis. And this brain-gut axis has a heavy influence on the symptoms that we could feel in our body. So, what are some of the different forms of irritable bowel syndrome? Some could be constipation predominant, some could be diarrhea predominant, and some could be a mixed combination of both constipation and diarrhea. So, here are the 5 signs you should look for when thinking that you might have IBS. Sign number 1 is abdominal pain when having bowel movements, which oftentimes can get better with having a bowel movement. Sign number 2, change in bowel habits, new constipation or new diarrhea, or a alternating pattern of constipation and diarrhea. Sign number 3, bloating, which is very common in IBS. Oftentimes this bloating gets worse after meals. Sign number 4, symptoms triggered by stress both at work or at home. Sign number 5, all normal testing. My patients will have normal labs, they'll have a normal colonoscopy, and then they'll ask, is there really anything wrong with me? And what I try to tell them that this is a functional disorder, and even though there might not be anything obviously structural, it is understanding that they have a condition which is causing them to have many symptoms. So when is it not irritable bowel syndrome? The red flags that you should look for are unexpected weight loss, bloody bowel movements, anemia, which is a low blood count, or waking up in the middle of the night because of your symptoms. Any symptoms like this should warrant you to go see a doctor. So what are some basic things that patients with IBS can do to improve their symptoms? If they have more constipation issues, I normally recommend increasing the fiber in their diet. That means a fiber goal between 25 to 30 grams of fiber a day. If they have a lot of diarrhea, I recommend a low FODMAP diet, which I described in a previous video of mine. And lastly, stress management, if that's playing a large role in their symptoms, as mentioned before, that brain-gut axis, and if we're able to control how our mind works and how we deal with stressful situations, that can also help with abdominal pain and bowel habit issues. IBS is extremely common, but understanding its symptoms is the first way of managing it. If you are interested in digestive health, please consider subscribing to this channel. Take care.